I'm nervous. While I have every confidence in the surgeons and the medical team, it's still, open heart surgery.
Cook Children's is often described as a castle with blue peaks, where children come to get better. However, for 40-year-old Amber Bartek, she calls it home. For 8 years, Amber was an employee at Cook Children's, but this year she became a patient, coming back to have open heart surgery at the very place she once took care of children.
Some of the symptoms I guess I'd been having, I just had attributed it to turning 40 and I just started exercising, so I thought some of those symptoms were just part of turning older.
Amber learned she had a subaortic membrane that had gone undetected and she would need open heart surgery to correct the problem. Dr. Scott Pilgrim, the medical director of the Adult Congenital Heart Disease program at Cook Children's, received her case and determined she would be a perfect candidate for the surgery.
Amber's case was a little unique in that she was not diagnosed with her heart problem until later in life. She was a younger middle-aged adult who was diagnosed with what we call a subaortic membrane, or tissue that had developed underneath the level of the aortic valve. While not necessarily truly congenital, it is something that we do see in children as little as infants all the way up into adulthood, and our surgeons are very versed at taking care of these types of problems. And so that fell right within our purview and right within our expertise of being able to handle that problem.
One early June morning, Amber, along with her sister and her husband, checked into Cook Children's for her surgery.
It feels just kind of like coming home. I loved it when I worked here. I thought it was one of the best places to work. And I always had every confidence in my fellow nurses and the physicians, and I honestly feel more at ease being here than even at the adult hospital in Kansas. I know the people here, and I know how skilled they are. I know how compassionate they are, and I am very confident and kind of just happy to be back.
After a successful surgery and a short stay in the cardiac intensive care unit, Amber spent weeks recuperating in Texas with her sister, who is a Cook Children's pediatrician. But her recovery was trying.
I have my good days and bad days. With heart surgery, especially open heart surgery, they said that both Dr. Pilgrim and everybody else I've talked to said that there is a great occurrence of depression and emotional lability. So I've definitely noticed that. So it's emotions can kind of go up and down. One moment I'll be fine and all of a sudden I'll be crying. It's a lot to kind of just take in, and being frustrated with what you used to do that you can't do right now. But knowing that, there's light at the end of the tunnel, it's going to get better. You just got to recover.
Just in time for the 4th of July, Amber was able to return home and reunite with her husband and her 5 children. She is taking the time she needs to regain her strength and prepared to return to her job as a nurse and take care of her patients. Both she and her sister are grateful for the staff at Cook Children's for this experience.
From the time that we walked in for registration that morning to when we walked out about 9 days later, I can't even tell you the level of care that we received. When you work at a place, you have a sense that what you provide, you feel like is good, compassionate care throughout as the system works. When you are then a patient or a family and you see it from the other side, it is just a total validation of why you spent your whole career here.
Thank you wouldn't even be enough. Seriously, all of them, every single person was amazing. They're responsible for giving me my life back. And there's just no amount of thank yous in the world, I think, that could cover it. But very blessed to have been a patient and a part of such an amazing team.